Well, the symptoms of heart valve disease, unfortunately, can mimic a lot of different things. It can be very common things like just not feeling well, being more tired, getting short of breath when you do even minimal things like walking or taking a shower. And unfortunately, the symptoms a lot of times will progress, and they can become more things that people would notice, like having chest pain, just not being able to do their normal activities, and ultimately, they can be very serious things, like even having passing out spells.
It used to be, it was always treated open. Are there advances today?
Right, this is an exciting time now in cardiac surgery, whereas before most of these problems were treated with open chest surgery, where we actually had to divide the sternum and expose the heart. Now we have options that are much less invasive, either making smaller incisions or sometimes not even really making an incision at all. We have transcatheter valves, which are valves that can be compressed to a very small size. And a lot of times these can be delivered with just a small puncture wound in the groin or underneath the collarbone, and saves the patient from having to have their chest opened, heart stopped, and patients just recover remarkably from these, and sometimes even able to go home the next day.
Okay. And who's a candidate for this kind of less invasive procedure?
Well, we do a full analysis using some preoperative testing to determine who is a candidate. But truthfully, that when this was first approved, it was really approved for patients who were not candidates for open surgery. And so because of that, it first became available to the really sickest of sick patients. But they did so well that now it has been FDA approved for those patients who are what we call low risk. So truly, almost anyone can be considered for a less invasive option. It's still true that sometimes we have to do open chest surgery, but now more and more it's more common to be able to offer a minimally invasive option.